Golf's a pretty popular sport, especially this time of year, and people are going to be getting out for the first time in months. Now that it's a little warmer, for a lot of people, this will be their first big activity of the year. So what can you do to avoid injuries? And if you have one, what do you do to get through it? Joining us this morning is Dr. John Anderson with Twin Cities Orthopedics. Thanks a lot for being with us.
Thanks for inviting me.
Now, what are some of the common injuries that golfers see, especially this time of year?
Virtually all of our golf injuries are soft tissue strain injuries. Golf is a torsional sport. We're twisting when we're making the golf swing, and so all of those muscles and joints have to be flexible, and if we're not properly conditioned, we're going to have injuries.
Okay, in this video, we're seeing some different stretching and warm-up exercises that golfers can do. Tell us about those that can help.
Well, what you're seeing here in the physical therapy department at Twin City Orthopedics, this is Brandon, one of our therapists, showing you exercises that we would instruct you to do once you've had your range of motion and flexibility analysis. We can really find a custom program for you that will very nicely fix your flexibility issues and your strength issues. I think if you buy a book or you buy a video, you're going to spend too much time doing 85 different exercises, and if we could reduce it down to what's specifically good for you with a good analysis, then we can teach you those 4 or 5 or 6 exercises that are really important for you to do. And this is a demonstration.
Yeah.
Brandon's doing a great job of showing you some training exercises as well as some warm-up exercises.
And I liked that one of those exercises he did with his golf club, so it's something you can do when you get out on the green.
Correct.
The other thing is, we've talked a little bit before we went on air here about technique and how important it is to use proper technique to avoid injury. I guess you got your swing down pat for us. You want to show us how you do that?
Well, this is the part where all the golf professionals watching might spill their morning coffee. But,
let's see.
But I'm going to demonstrate what would be a good orthopedic golf swing. And again, I want to remind you that we're talking about trying to distribute the torsional forces of a golf swing throughout the whole swing. And that means that from the neck and shoulders on down through the spine and hips and pelvis, the knees, ankles, everything has to move. And if you're not properly conditioned or you're stiff, and let's face it, most of us get stiffer as we get a little older. And so people like me have to work especially hard on getting that flexibility, or we're going to injure something.
Okay.
For example, if you have a bad hip or a bad knee and you can't turn on it and you can't rotate, you're going to hurt your lower back. It's just going to be toast.
Okay. Well, we're kind of running out of time here, but I think we do have time for you to show us a quick swing.
All right. First of all, you have to set up properly. You have to have hips and knees bent. If you have your knee locked, your back knee locked, you can't turn.
Okay.
So hips and knees bent, and I'm going to try not to hit you here on my back swing.
All right, I don't want that either.
But we have to rotate all the way back.
Okay.
And then swing all the way through. You want to turn and face your target. And if you do all of that and have good rotation, I think that ball's on the green. We're going to make a birdie putt.
Very good. I think you got a hole in one. Thanks a lot for joining us.
Thank you.
If you want to hear some of the tips from today's segment, go to our links page at KSTP.com right after this show. Coming up, if you think Americans are nice, well, maybe not as nice as some other countries.